Today's discussion is about sociocultural factors, family, its role in health and disease, and the correct assessment of socioeconomic status. So, there are three parts. One is sociocultural factors. Perhaps in the first year, it has been discussed about the determinants of health. Can anybody tell me? It has already been discussed the first year, perhaps first year, or in the first half of the second year. Determinants of health means what are the factors that influence health? আমরা বা আমাদের স্বাস্থ্য ভালো থাকবে কি থাকবে না কিসের উপর নির্ভর করছে? They are called the factors or determinants of health. Now I will discuss about this only, mainly the sociocultural factors. Okay, this is very important factors that influence our health. At the same time, family is very important because it has a great role to play whether we will be healthy or not. And last one also, socioeconomic status, socioeconomic conditions, or rather I should say socioeconomic status of the family, of the community. Again, it also determines whether we will be healthy or not. Okay. So, these are the topics. Now, on the basis of the topics, I have prepared 4 objectives for you to learn. At the end of the sessions, you, the students, will be able to know the different socioeconomic factors that influence health. Number 2, understand the importance of these influential factors, and third one, comprehend the role of family as one of the essential influential factors, and last one, to assess the socioeconomic status of a particular family, how to assess. So, these are the 4 objectives. These 4 objectives will be keeping in mind. You have to pay your attentions and listen. Now, these are the sociocultural factors. So, health is influenced by multiple factors. The important factors are key. So, these are the 8 important sociocultural factors that influence our health. Whether we will be healthy or not depends upon these several sociocultural factors. The first one is heredity. Perhaps all of you have the idea about the heredity, and at the same time also environment. Which is more important, heredity or environment? Heredity is very difficult to predict. Sometimes we say equally important, sometimes we say this is more influential than heredity. Perhaps you know that a number of diseases are known to be genetic in origin, like epilepsy, mental retardations, some types of diabetes, few blood related diseases like hemophilia, thalassemia, etc. So, few diseases are there, these are hereditary. We cannot totally prevent them, definitely. We can also prevent them if we can educate the people about these diseases, about the causative factors of these diseases. So, how we can prevent this? We can prevent, especially about the blood diseases like thalassemia and hemophilia, we can prevent the diseases, okay, by counseling. So, you have to counsel, you have to take a role as a counselor before marriage. So, premarital counseling. And again the environment directly influence the physical, mental and social well-being of human populations. Without these things, we cannot, without environment, without healthy environment, we cannot survive. So, this environment directly influence the physical environment, physical, mental and social well-being of the human populations. And next one is, now what does it mean? The environment ranges from housing, water supply, sanitations, air, noise, psychological stress and socioeconomic support systems. Now, you should have the idea housing, perhaps you know what is housing, okay. If the housing is not good, if the condition of the housing is not good, very many diseases may occur. If we live in a damp house, if the house is ill ventilated, if the house is not airy, then different types of disease may spread. Next one is water supply. If the water is not sufficient in quantity, if it is intermediate, then there will be a problem. Is it so? If we do not get the water, what will happen? We cannot perform our normal activities. And again, if the water is not safe, ওই জল যদি নিরাপদ না হয়, if the water is not safe, then what will happen? If we drink it, if we drink the contaminated water, then what will happen? We may suffer from different waterborne diseases. Now, safe water, that is important. Safe water means what? Do you have any idea about safe water? What is safe water? Any idea? This is one of the important determinants of health. If we do not have the opportunity to get safe water for consumption, for drinking, then we have to suffer from different waterborne diseases. So, first we should know what is safe water then, because we require it. Government will supply it or we ourselves can arrange for safe drinking water. Idea আছে? Any idea? Safe water? This is different from pure water. Safe water. কোনো আইডিয়াই নেই। আচ্ছা, less important that you are telling, still okay. Colorless. Next, odorless, tasty, okay. So, from less important, I am coming to the more important characteristics. Odorless, achha, colorless, odorless, tasty, then achha, minerals will be there, oh, fine, okay, then free from any disease causing germs, and next, free from any harmful chemical substances. First two are more important, all are important. So, we require to get this type of water, then we can prevent ourselves from very many waterborne diseases. Can anybody tell me about the examples of waterborne disease? Diarrhea, yes, typhoid, cholera, polio, poliomyelitis. So these are the hepatitis A. These are the waterborne diseases. So we can prevent this. So safe water supply, that is one of the important determinants whether we will be healthy or not. Next, air. Again, air consists of what? Air e ki thake? Constitution of air perhaps everybody knows from class 7 to class 12. Okay. Constituent of air, air e ki thake? What are the things? Oxygen thake na thake na? Oxygen আর কি nitrogen, carbon dioxide, water vapor and other trace elements. Okay. If the air does not contain the required percentage of oxygen, or if the air contains more carbon dioxide, so what will happen? Or rather we can say simply, if the air is polluted air, if we breathe the polluted air, what will happen? This one. What will happen? All the disease, respiratory disease. Okay. Then noise. Okay, crackers, potka, bajje. It is restricted still due to machine, due to vehicles, whatever may be. Okay. If noise is out of this limit, out of 90 decibels, what will happen? There may be rupture of eardrum, temporary deafness, irritations, automatically we may suffer from stress. Again, psychological stress. Okay, here also in the class, stress. কি দরকার এত ক্লাস করার? So many subjects are incorporated in our syllabus. What is the necessity? This is a stress. Again, in the workplace, there may be a stress. In the family, there may be a stress. So stress means also psychological stress, manasik chap. That is also very important. If we cannot cope up stress, once we are human being, only small kids do not have the stress. Okay? যখন আমাদের জ্ঞান হয়ে থাকে তখন থেকে কিন্তু আমাদের স্ট্রেস থাকবে, বাট উই হ্যাভ টু কোপ ইট উইথ সাম ট্রিক্স, উইথ সাম টিপস, উইথ সাম মেকানিজমস. ওকে, অ্যান্ড লাস্ট ওয়ান ইজ social and economic support systems. If we do not get the support from the society, if we do not get the support from our family, economic support as well as other supports, then our health will suffer. Next is lifestyle. Lifestyle. What is lifestyle? It's a way of life. Way of our life. That is called lifestyles. How we spend our day-to-day activities. That is lifestyles. What do we do? That is our lifestyles. It contains a whole range of values, attitudes, customs, folkways, mores and activities. So there are few terminologies. Okay. So while we are discussing about the lifestyles, it's a way of life, how we perform our different activities, what we do, what type of weightage we give to the opinion of the others, what type of knowledge we have, what will be our attitudes. So these are the lifestyles. So first terminology is, hey, ye nahi keno? Duster koi? Hath diye muchchi? Nahi baba. দেখ ওই মধ্যে আছে কিনা দেখো, তাড়াতাড়ি নিয়ে বাবা। Now values, that is important terminology. Values, in Bengali we call it, বলো, মূল্যবোধ, value system. Is it? Values? প্রত্যেকে বাঙালি এখানে যারা আছো? Who do not know Bengali? You too. Okay, values. Now see, values. Values means what we believe plus what weightage we are giving to that belief. That is called values. আমি বিশ্বাস করি, we believe it, and if we give that much weightage to this belief, then it becomes a values. Then I told you about the customs. This is also important. Customs. Everybody knows the word. Again, whether it will be healthy or not, again depends on our customs. That is also important. Custom means what? বাংলাতে কি বলি? না বাংলা জানো না ইংরেজি, কি ব্যাপারটা আমি বুঝলাম না। হোয়াট ইজ দ্য মিনিং অফ দি কাস্টমস? হ্যাঁ বলো, রীতিনীতি তাও চলবে, প্রথা চলবে। কাস্টমস, কাস্টম মিন্স নবস। ওকে, each and every societies, each and every communities had their own customs. Say for examples, in the morning what do you do? What do you do? In the morning, once we woke up from, or get up from our bed, what do? We wash our hands. This is nothing but customs. Okay? Is it? Then sometimes we worship gods. That is a customs. We wish ourselves. Okay? We wish others good morning. What is this? This is nothing but, it's a customs. Clear? So customs again, it can divide it into two, folkways and mores. Folkways means folkways. Folk means folklore, folk song. Folk means people, manush. Folk ways means the ways of the folks, the activities of the folks. This is called folkways. Is it? Again, our health depends on folkways. সকালবেলা উঠে আমি ব্রাশ করলাম না, দিনের পর দিন ব্রাশ করছি না, আমার স্বাস্থ্য ভালো থাকবে? থাকবে না। So folkways, the activities of the people. There is no written documents about the folkways. Is it written? No. Nothing is written about the customs. কোথাও লেখা আছে? নেই। Depends upon the society. It depends, varies from family to family again. Not only the community or society. Each and every community has their own customs. Okay. So folkways means activities of the people. What you eat, how we talk, how you greet, how we eat, what do you eat, কি খাই, কিভাবে খাই, so কিভাবে চলি, কিভাবে কথা বলি, these are the folkways. And next is mores. This is also a customs, but folkways is not mandatory or essentials to follow, but mores is essentials. If we do not follow the mores, then our society will be breaking up. Okay? This is mechanism. Mores is the mechanism of controlling the society. That is called mores. Certain things are prohibited and certain things are compulsory. Marriage system. Marriage, we call it mores. For the survival of the human society. Certain things are prohibited in our society. In other societies, it is not prohibited. In our, till today, in our society, marriage is essentials, and marriage within our kith and kin, within our cousin brothers, within our brothers and sisters, Is it prohibited or not? Is it prohibited or not? Marriage within our kith and kins, marriage within our brothers and sisters, it is prohibited. That is taboo. Okay. Again, if we marry within our clan, you know? Do you have an idea any clan? Why it is prohibited? Do you have any idea about the clan? Bolo. Clan means in Bangladesh ki bole, in Bengali what do you call? This is our fault. This is our fault. Our bills, the father figure like us, this is our fault. We could not rear you correctly. Clan means Gotro. You know Gotro? So, marriage within the same clan is prohibited. Is it? Because there are some weaknesses. If we marry within our clans, within our blood relations, then what happens? That certain diseases may occur. Clear? So, lifestyle means a whole range of values that I told. Attitude. Attitude means what? A tendency to act. Ami korbo ki korbo na. This is the tendency. Whether I do it or not. That is attitude. I told you about the folkways, mores and several activities. They are often adopted as a result of sociocultural interaction. These things which our value system, our customs, that is mores, that is folkways, whatever may be the activities, how we learn? We learn from the social and cultural interactions. When you grow up, our parents, our siblings, elder siblings, our parents, including neighborhood or kith and kins, rear us. And we learn many more things. What to do, what not to do for our well-being. Through socializations, we acquire all these things. This is called through socializations, we acquire all these things, and these things, folkways, mores, norms, customs, if we follow, then we will become healthy in future life. So this is called socialization. It's a process through which we can learn the norms, the folkways, the mores, the customs of the society, and we become a responsible citizenship in future. And these are the result of social and cultural interactions. Very often or always we interact among ourselves, we interact with others, we interact with peer groups, we interact with other members of other society. Say for example, there is interactions between Bengalis and non-Bengalis. Culture is same or different? Culture is different. So, with these social and cultural interactions, we acquire many more things, and the folkways, the customs are being changed also. Just what I mean to say, that in this juncture it is important to discuss, that is why I am discussing what do we mean by social and cultural integrations. What happens if we interact among ourselves, means যখন আমরা ভূমিষ্ঠ হই, okay, when small kid, as a small kid, we are within the family. Once the age is become more and more, we go to the nearby places, we acquire many more things, we are acquiring the norms of the other persons. Okay. So, there are three processes. One is called acculturation, and is called enculturation. Next one is assimilations. These are also important to know for you, because you see what I am discussing about the socio-cultural determinants of health. How the social and cultural factors influence our health. Whether we will be healthy or not, it depends upon heredity, it depends upon environment, as well as depends upon lifestyles. That lifestyles again depends upon our customs, or integration, cultural integrations. One is called Enculturation, another is called Acculturation, and third one is all words has come from the terminology culture. Everybody knows what is culture? Each and every society has its own culture. বাংলাতে কি বলি কালচারকে? বাংলাতে কি বলা হয়? বলো, those Bengali speaking people please. মাথা চুলকাচ্ছে। কৃষ্টি, সংস্কৃতি, culture. Culture consists of different types of customs, traditions, belief systems. So, one is enculturation. This is nothing but the rearing process within the same cultures, staying within the same cultures. We learn different components of these cultures, how to behave, how to talk with others, what things we should follow. This is called socializations, and we become socialized with the process. This is called enculturations. And next, acculturations means examples were wearing shoes, wearing pants, wearing sweater, wearing shirts. Before 100 years, we used to wear dhoti and Punjabi. In Bengali I am telling you. Okay? Now we are accustomed or used to wear this type of shirts and pants. How it has come? Through acculturations. Acculturation means when two cultures come into close and continuous contact, okay, interact among themselves. One cultures adopt many more things from the others, then evolve a new culture. Not Western cultures, not Eastern cultures, mixed cultures. Okay, that is called acculturations. Examples are adoption of fast food, wearing these shirts and pants, smoking, okay, cigarettes. Previously, the Eastern people, hookah. Now, cigarette, churut, like this, alcohol, other addictions, sedentary lifestyle. Okay, one thing I forgot to tell you, assimilations. Here, three things are theirs, okay, due to social and cultural interaction. One is enculturations, that is socialization process. Everybody has gone through, all of us has gone through the process of enculturation, means rearing process, means socialization, then acculturation, effect. Westernization is there. Last one is assimilations. Sometimes it happens. How it happens? When two cultures come into contact, continuous contact, okay, two cultures. Then one culture has forgotten everything of their own, almost everything, and mixed with the others. That's all. This is called assimilation. Okay. For example, adoption of fast food, smoking, alcohol, other addictions, changes of dress patterns, irresponsible sexual behavior. Okay. Next. This is the next factor. Which factor? Sociocultural factors. Rather, we can say till now what I am discussing all are social factors. Okay. First one is heredity and environment, then lifestyle, and third one is socio-economic, not status, socio-economic conditions. Now, do you agree that our health, whether we will be healthy or not, whether we can prevent ourselves from different diseases, depends on socio-economic status? All of you will agree. Now, what do you mean socio-economic conditions? What do you mean? Number one, economic status. First one is only economic status. Economic status determines the purchasing power. If you are economically viable, so we can purchase many more things according to our own requirement. Then standard of living will be high. If standard of living will be high, quality of life will be improved. And next one is, then only we can pay attention towards health. Okay? Now, if we think about the basic needs, what is your basic needs? আমরা পড়ে এসেছি 3 words only. কি কি? Basic need? বলো, বলতে পারবে, প্রত্যেকে বলতে পারবে। 3টে ওয়ার্ড, only 3 words. In English, food, clothing and shelter. In Bangla, খাদ্য, বস্ত্র, বাসস্থান. But health is not included, the basic needs. But definitely, if we can afford our food, if we can afford in our housing, then only we can think about health. Okay? So, economic status determines the purchasing power, standard of living, quality of life, and attention towards health. That is not enough. As regards to socio-economic condition is concerned, next one is education. Definitely, education greatly influences health. If you are educated enough, then we can think about how to prevent disease, how to promote health, how to cure disease. There is a direct relation between education and health. Okay? So, greatly influence the healthcare seeking behavior as well as health status. At the same time, if you have become illiterate, so illiteracy has closely coincides with poverty, then automatically poverty people suffer from malnutrition. If we suffer from malnutrition, then question comes out ill health, and then if we have become sick, then question comes about mortality. And third one is occupation. Again, there is a relationship between occupation and health. So, for example, I have enough money, I am illiterate, I am a labor, maybe agricultural labor, maybe industrial labor, but I may not have the capacity to think wisely about the promotion of health, prevention of disease, how to maintain our health. No. So, for the reasons, we require suitable employment in productive work, then we can promote health. Again, not only this employment, but also it depends upon job satisfactions. If we are satisfied about the job we perform, then there will be less stress. Okay? Then we will be mentally healthy. Then we can think about the well-being, automatically we can be healthy. Okay? So, first one is economic status, second one is education, third is occupation, and last one is political systems. We cannot deny the political systems. Many more things depends upon our political systems. So, what does it include? These political systems can shape the health of our people, health of the community, as the resource allocations depends upon the political systems. In every year, in the month of February, perhaps you have the idea, you listen radio, read newspapers, visualize TV, budget. Every year budgets is there, okay, and in the budget resources are being allocated in different sectors. So, one of them is health. So, resource allocations depends on the political systems. Next one is manpower policy, whether manpower will be required or whether employment generations in health sectors, especially we are more concerned about health sectors depends upon the political systems. What type of technology we will choose depends on the political systems. Then how we can protect our environment again depends on the political systems. And last one is availability and accessibility of the health services to the different segments of populations to promote health, prevent disease and prolong life depends upon the political decisions and political will. Okay. That is all about the socio-economic conditions. So, first one again I would like to remind you heredity and environment, lifestyle, socio-economic conditions, next one is health services. Everything is there, policy is there, fine. Resource allocation is there. We have enough money. We are engaged ourselves in different suitable occupations. Job satisfaction is there. But if there is no appropriate health services which is not available, which is not acceptable, which we cannot afford, which we cannot utilize, then what will happen? The result will be big, zero. So, availability, accessibility, affordability and utilization of health services will definitely influence our health of the community. Karonta ki, what is the cause? Because the purpose of the health services is to improve the health status of the community. Just again I am giving some examples. Health services means provision of safe water supply, that is important. Next one is healthy environment. If the environment is not healthy, solid waste management, now we are thinking about management of solid waste, management of liquid wastes, environmental sanitations, global environment we are thinking about that. Then immunization programs, we arrange immunization programs for children, for women, not only for children and women but also for old people also. So, these are the health services. Again our health depends upon health services. So, what I discussed about almost all the social factors. Now, again pinpoint about the socio-cultural determinants. This is the cultural determinants. Cultural factors in health and disease. Already I told you, each and every community has their own customs, has their own cultures, okay, own belief systems, own practices concerning health and disease. Can you give some examples, few examples about their cultural practices, about our practices that are related to disease or health? All customs are not bad. Few are good, few are bad. We follow it without knowing or not knowing. Unknowingly we follow the customs. Can you give few examples? Suppose one examples. Okay, culture, belief system and practices. Now belief, first think about the belief systems. Now you see till today those who are not that much educated, even among the educated people also, if a family member suffer by chicken pox, what they feel, what they practice, what they believe, many people go to mandir or temple or different pilgrimage to worship the goddess of কি god কি আমাদের কি দেবতার পুজো করি চিকেন পক্স হলে শীতলা আমরা শীতলা পুজো করি we perform. This is the culture, nothing but. Then when a child, in case of newborn child, কি করি আমরা? We use kajal in the upper eyelid. These are the customs. Not in case of child. Many people use here, কি পড়ি এখানে? In Bengali we call it tabiz, koboj. In English we call it beads and charms. We do it. Okay. So these are the cultures. These are the practices, belief systems and practices. These influence health or not? These also influence our health. Bad one is, I told you about the bad one, eyelid. Okay. Then we use vermilion, or এখানে আমরা আঁকিঝুঁকি. Not harmful, but not helpful. This is not harmful, but this is also not that much helpful. But one helpful, say examples, do not run in the sun. During pregnancy, pregnant women are not allowed to cross the river. That is good. She is not allowed to walk in the hot days during summer. That is good customs. Now, it deeply involved in each and every aspects of human life, including health and disease. That I told you this one, all customs and practices related to health and these are not bad. Some are good, some are neutral, some are bad. But yes, next, that is very important. Many health programs, perhaps you have the idea about the different health programs undertaken by the government of India in collaboration with the state governments, apart from our 3-tier healthcare delivery systems. Now we have to interlink. We have the 3-tier healthcare delivery system. Do you have any idea? কিভাবে স্বাস্থ্য পরিষেবা আমরা দিই? From the government level, in the grassroots level, there are the institutes that is called, সবই তো পড়ানো হয়েছে ডেফিনেটলি, সাব সেন্টার আছে তো, তার উপরে কি আছে? অ্যাবভ দি সাব সেন্টার পিএসসি টিয়ার, তারপর সিএসসি or বিপিএসসি, then these are the tiers. So along with these 3-tier healthcare delivery systems, it is not enough for the disease. Government of India in collaboration with state governments undertake different national health programs for prevention and control of diseases. Can you name any national program? স্বাস্থ্য কর্মসূচি বলো তো, একটা বলো. All of you know different programs, but you cannot, right now you cannot say, বলতে পারছো না. Water supply and sanitation program, National Tuberculosis Control Program, right now revised National Tuberculosis Control Program, Vector-borne disease control program, leprosy control program, malaria eradication program. These are the programs. Even from the Director of Social Welfare, another program related to health and welfare, ICDS program. জানো তো, integrated child development services scheme, ICDS program, applied nutrition program. There are different programs. Food for work program, Pradhan Mantri Sadak Yojana is a program, not directly related to health. These are the national programs. So, but you see, there are different health programs, but we do not bother about the influence of cultural factors for the implementations or successfulness of this program. For the disease, Many of our health programs remain fails as we do not consider the influence of cultural factors in health and disease while providing healthcare services to the community for promotion of health, prevention of disease, maintenance of health and cure diseases. Now, there are different factors that are prevalent in different parts, in different parts of our country, including our state, all the states. Number one, concept of etiology and cure. How disease occurs and how disease can be cured. Before the discovery of microscope, before the discovery of germ, all of us had to depend upon supernatural theory. Perhaps you can remember the history of health, somebody had discussed definitely, Charok and Sushrut. Then supernatural theory, eternal theory. What is that? There are, people thought, till today people think there are some supernatural causes of causation of the disease and there are some physical causes. What are the supernatural causes? Worth of God and goddess. দেবতা প্রচণ্ড রেগে গেছে যার জন্য আমাদের রোগ হচ্ছে. The best example is chicken pox. Till today people believes. Next is breach of taboo. I told you what is taboo. Taboo means the things that are prohibited. আমরা যদি tabooটাকে না মানি, then people think that few diseases may occur. What is that? STD, simply people till today think STD, breach of taboo. Next, past sins. People believe that. Not only believe, it is a practice. Different parts of the country, past sin. Due to past sins, we believe, we think, without thinking scientifically, that leprosy, কুষ্ঠ, পূর্বজন্মের পাপের ফল. Past sins, evil eye. A small child, a little child, a small kid, always crying. We do not think about the other causes. Sometimes we think, কিছু একটা হয়েছে, জল পড়া দাও. We call the persons who is renowned in this area. Next is spirit of ghost intuitions. এখনো আছে. We call the gunin, we call the oja. Something, the ghost has entered into the body of the human being, especially in case of mental illnesses. We cannot think that person is suffering from mental illness, he is mentally sick. We cannot think. We think about the spirit of ghost intuitions. These are the supernatural causes. And next is physical causes. Number one is effect of weather. Due to change of weather, we suffer from different types of diseases. And next one is water. No need to discuss. You know about the importance of clean, safe water. Other causes, impure blood, রক্ত খারাপ হয়ে গেছে. Okay, নিম পাতা খাও ঠিক হয়ে যাবে. So this is the belief systems, cultural practices. And next one is, that is also important, environmental sanitation. Number one, disposal of human excreta. Till now in the cities also, in the towns, not only in the villages. WAS. Our Modi government has introduced the terminology WAS, water, hygiene and sanitations. We have the idea. Do you have the idea about this one? What I have written? ODF. Any idea? ODF? Full form is open defecation free. What does it mean? ODF, open defecation free. That means there will be no people in the community who will defecate in the open field. That means all people must use sanitary latrine, including small child. But what we do? We also do. That is bad. We defecate in the sanitary latrine. But what about our kids? With the help of small piece of newspaper. Okay? There itself the child defecates and we throw it here and there. So, disposal of human excreta systems. Then next, disposal of waste. Now, definitely there is no system in the villages till today. In the cities there is systems. One whistle, persons used to blow whistles, we keep ready, but again there are two buckets. Is it? Do you have any idea about the different types of buckets that are provided by the corporations or municipalities? One bucket is of which color? Idea is green, another is blue. So, one is meant for keeping biodegradable waste and another is meant for non-biodegradable waste. Do we do it? Do we keep it separately? No. Mixed. Give it. So, this is about disposal of waste. That is again important. Why it is important? Again cultural determinants. Again cultural practices. Scientific reasons are there. If we do not dispose the wastes in a scientific manner, fermentation will be there, then that will be atur ghar. Kisher atur ghar? Mosar atur ghar hobe. Breeding place of mosquito. All the mosquito borne disease, vector borne disease will occur. Can anybody tell me at least two diseases they are vector borne? Follow? Malaria and kalajor. Kalajor. Malaria and dengue. Kalajor noy. Kalajor noy. Kalajor hobe. Kalajor. Okay. Next is water supply. No need to discuss. Okay, already it has been discussed. Water supply. Quantity and quality both is important. Sufficient quantity is required. Otherwise, we cannot maintain the personal hygiene. We cannot wash our hands. We cannot wash our clothes. We cannot wash our utensils. For that reasons, we say, as a health education specialist, we say, don't go to the shop for eating if there is no tap water. যদি দোকানে tap water না থাকে, avoid that shop. Why? Because if there is no tap water, no sufficient quantity of water, no question of thorough washing of the utensils, automatically contaminations will be there. You may have to suffer from diseases. Okay. Then housing. Okay. Last one is food habits. Again this is also important factors that influence our health. Food habits. What type of food we eat. Next is special customs, practices related to mother and child health, because mothers means women's and childs are more and more vulnerable. For that reasons, we have to focus upon mother and child. Mother and child health is surrounded by a wide range of customs and beliefs all over the world. Is it? During pregnancy, what is bad I am telling first. During pregnancy, our customs are there. In some places, that pregnant women are not allowed to eat egg. It is thought that they have to face difficulty while delivery. Egg allow no. And next, one myth is there. During pregnancy, the woman is not allowed to eat pineapple. But is it scientific? Still it is prevailing. And again papaya, question of papita or papaya. Okay? Marriage is universal in India, fine. Till today, family is again question of health. Family is incomplete without a male child. For the reason government is compelled for the slogan, Bechi Padhao, Beti Bachao. So all these things are related to health. Last. Then in the next class, I will discuss about the family and socioeconomic status. The various customs concerned to MCH, just for sake of remembrance. All of you know, but you do not hit this one. Good customs like prolonged breastfeeding, it's good. Do you have any idea about the breastfeeding? How long it must be continued or exclusive breastfeeding? Any idea? Exclusive breastfeeding for how many months? 6 months. And breastfeeding up to 2 years. These are customs. Continuation of breastfeeding. Then oil bath, this is good. Oil bath, bachchake, tel meke, rode শুয়ে রেখে স্নান করানো, this is good customs. Massage, good customs. Exposure to sun are good customs. What is the bad? These bad customs all are influential factors of health. Unnecessary I am not discussing. They vary from society to society. Some foods like eggs, meat, fish, milk, etc. are forbidden during pregnancy. Application of kajol in the eyelid of the newborn. Again, bad is discarding colostrum. Perhaps you have the idea of the colostrum? Colostrum, first yellow milk, okay. So, usually we discard it because we think this is very bad, but that is very nutritious. We say this is the first immunization of the child, colostrum, okay. Unimportant, but we follow. Certain customs like punching the ear and nose, application of oil or paste of turmeric on the anterior fontanelle. And last one is personal hygiene, that is related to health, needless to discuss, just for your remembrance. Number 1, oral hygiene, how we brush our teeth, how we rinse our mouth, bathing, shaving, smoking, porda system, sleeping, wearing shoes, circumcisions. So these are the belongs to personal hygiene. Okay, that's all. Okay, now 2 minutes I can take for recapitulations. If you have any, perhaps many more questions are evoked. Ask me. So about today's discussions, what I discussed about social and cultural factors that influence our health. If these factors are not up to the mark, are not amenable, are not conducive to health, then we cannot think about well-being of people as far as health is concerned. Okay. So other two things that is also important, one is the role of family in health and disease and role of socio-economic status in shaping our health.